Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet every Saturday at 10:30 a.m. to talk about some new subject about prostate. We're live on YouTube, we're live on Facebook, and we're live on X every Saturday at 10:30. So join us. This is your first time joining us. Be sure to go to our website at UroPatient.com, the best place to get more information about the show and to watch all of our past episodes. Be sure to check out our handouts. We've got a bunch of them there for you. Lots of helpful information. Almost every show we produce some kind of handout for you. So today we got a really good episode. I thought it was a good time to talk about this. It's something called biomarkers. I know it's going to get into some really heavy lifting to talk about biomarkers because not the thing that is in general conversation, but I think it's important for prostate cancer, whether you're being screened for prostate cancer or if you're going to be treated for prostate cancer, to understand what some of these things are, have a little basic knowledge so that you can sometimes drive your own healthcare. Make sure you stay with your clinician who's telling you what to do, but make sure they're up to date with all these latest tests. So let's talk about biomarkers today. All right, so today we're going to discuss the growing importance of biomarker testing in prostate cancer care and why it must be a top priority in 2025. So prostate cancer is the second most common cancer among men worldwide. Traditionally, diagnostic methods such as PSA and digital rectal exam have limitations. So biomarkers testings offer a more precise risk stratification. So what are biomarkers? I'm going to be throwing a lot of fancy words around today, so bear with me, but I think it's important to give you an understanding of what they are. Biomarkers are these biological molecules indicating normal or abnormal processes or disease presence. So example would be, you've heard of like genetic mutations or certain proteins that are found when there's cancers or certain metabolic changes. These are all important things that we can use as diagnostic tests. So they're broken down into some different categories. So diagnostic biomarkers are used for early detection. One of the things we're trying to do is figure out who needs a biopsy and who doesn't need a biopsy. And some of these biomarkers can help us make that decision. Might spare you going through a biopsy. And of course, I talked about what's involved with that couple of episodes ago. But PSA is our number one that's been around forever, as long as I've been in practice. Prostate-specific antigen. What it stands for. It's the most commonly used biomarker, though not highly specific. That's its drawback. We always say tests can be very sensitive and they can be very specific. Rarely are they both sensitive and specific. So it's highly sensitive, but not very specific. Elevated levels can sometimes indicate prostate cancer, but also benign conditions, just like prostatitis and inflammation of the prostate, or BPH, which is benign enlargement of the prostate. Now, things like PCA3 or prostate cancer antigen 3, here's that fancy word, a urine-based test can help distinguish prostate cancer from benign conditions. Something called the 4K score is a blood test. It predicts the likelihood of aggressive prostate cancer, and this will help reduce unnecessary biopsies. Something called the PHI or Prostate Health Index is a test combining total PSA, free PSA, and pro PSA to improve specific accuracy. We're always looking at better ways to get the test done. Again, this is to try to hopefully prevent some patients from going through a biopsy that they don't need. Now, there are other ones that we look at to call prognostic biomarkers. And what they do is they predict disease progression. So one of those would be the Decipher test. It's a genetic test that can help determine the aggressiveness of prostate cancer and predict your risk of metastasis. So if we diagnose cancer, we don't always have to treat it. Sometimes you can watch it, and some of these tests help us decide that likelihood. Oncotype DX, genomic prostate score, is another one of these tests. It assesses the likelihood of prostate cancer progression, and again, can help in deciding something called active surveillance, which means we know you have it, but we don't need to treat it, versus having to treat this procedure, going through treatment procedures. Another one is something called the Prolaris test, and that measures tumor aggressiveness by analyzing gene expression, fancy term I know, and assists in treatment decisions, which is what you need to know. So again, a lot of fancy words I have to throw out here because this is fancy stuff. There are predictive biomarkers that we use to guide treatment choices. So what's the best treatment for a patient? Now we can get some more information on what's going to work. All right, I'm going to really tell you right now, these are doozies. There's something called the ARV7, which is androgen receptor splice variant 7. All these gene terms, if you're not dealing with this on a daily basis, it just kind of goes over your head. But hey, I think it's good to know, so that's why I'm throwing it out here. They're found in circulating tumor cells and indicates a resistance to androgen receptor targeted therapies, which are some medicines that we use specifically to treat prostate cancer. Now, all medicines have side effects. Knowing whether you're going to be receptive to this medicine or not makes a big difference. If it's not going to work, why put you through the side effects? If it's going to work, great. And maybe we should use something else because you have this particular resistance. There's something too that there's a lot of talk about. You may have heard this term called the BRCA. It's the BRCA1 and BRCA2. They're genetic mutations. And these genetic mutations have been linked to a hereditary prostate cancer. Men with these mutations respond better to certain treatments, something called PARP inhibitors. And so you might be put on those. Again, very specific, very not always that common, but knowing what to test for can make a big difference. In the old days, we just gave everybody the same treatment. And some responded and did really well. Some didn't do really well. Now we kind of know why those that didn't do well were not able to get good results. Now, there is a way to kind of monitor prostate cancer to see whether it's aggressive or going, spreading or whatever. We used to just do another biopsy just to kind of do it. And sometimes that is part of the, when you're doing this watchful watching, watching the cancer, just kind of monitoring it. But there is something called a liquid biopsy. It's a non-invasive way to monitor it. It looks at cell-free DNA and circulating tumor DNA. And it can detect prostate-specific mutations in the blood, allowing real-time monitoring of treatment response. That's a good thing to know, whether it's working or not. Something called EXO-based test. It detects prostate cancer related to RNA signatures in the urine. RNA, if it rings a bell, that's one of the things that the COVID vaccine used was targeting messenger RNA, mRNA. So if you heard that RNA, that's what it stands for. There's DNA and there's RNA. That's all I'm going to tell you about it. There are predictive biomarkers that help guide therapy selections, such as whether someone goes on to hormone therapy versus chemotherapy. Prognostic biomarkers inform disease outcomes. Biomarkers can help in active surveillance versus treatment decisions. So what are the barriers? Well, there's a lack of awareness among healthcare worker providers and patients. All these things are fairly new and have come up recently. So, we're not everybody's aware of these. And nowadays, even most urologists are having advanced prostate cancer treatments specialists in their groups. Ours happens to have that in our particular practice. So these are docs that are really studying all these medications and all these biomarkers, and they're the real geniuses in all this. So you're going to end up wanting to see. There's limited insurance coverage, and these are not cheap, high cost. Everything, when it comes out new, it's going to cost a lot because they're trying to recoup all their research and development. But again, don't let that be a reason for not having it done. Standardization challenges in biomarker testing. Remember, I just went through a whole list of things. Which one should you have done? Do you need them all? I probably don't. So that's an important thing to know too. Now, 2025, this is why we're talking about it. Prioritizing biomarker testing can significantly improve prostate cancer diagnosis and treatment, leading to better patient outcomes. We all want that. Increased evidence now supports biomarker efficacy. So if you've got prostate cancer and they haven't talked about any other testing, bring it up. Ask the doctor, are there other tests that can be done that can help me? Because again, sometimes, you're in a practice that has specialists that are dealing with prostate cancer, all urologists deal with prostate cancer, but again, whether they're using the biomarkers or not, it may not. That's why you come to UroPatient to learn more. So, how do we increase biomarker testing adoption? Well, educating clinicians, the docs that are providing the care, and you, the patient, which is why I'm giving this talk. You need to advocate for yourself a lot more than you probably think. Pushing for things like policy changes and insurance coverage is big too. And a lot of the companies that are producing these things are advocates for you also. They'll help to get coverage for it and make arrangements so that it can get covered. But integrating biomarker testing into clinical guidelines so it becomes the standard of care is the best thing that could happen. And, just like PSA, when it first came out, there was a lot of debate about whether we should be doing PSA screening or not. And now it's, part of the routine. So we've got some real guidelines on it. That's what's really important. So biomarker testing is revolutionizing prostate cancer. We definitely need more education. We need some policy changes, and funding is needed. So join the movement to make biomarker testing a priority in 2025. I hope you found this interesting, and I hope you enjoyed it. All right. Well, I told you it was going to be a little tough to understand some of that stuff. I sometimes stumble through it myself. So all these things are coming up so newly, and there's introductions are so new, and there's so many. As I said, it gets to be a little confusing. But don't let it confuse you. Just make sure that you advocate that for all the testing that you should have done. Of course, your doctor's going to know what you should have done too. So make sure you ask to, talk to them about it. It's, you're the guy who's got the thing to worry about the most. I always say that, you got the most invested in it. Remember that. And we'll see you next week for another episode on UroPatient.com.